physio, it's important that you identify that they're insured and they're qualified to a good level. What to expect from your physio when they come, again, depends on that professional. However, I would say the main approaches most people have they'll come and they will do a background and a history check. They'll talk to you about you, your horse, and what you do with your horse. They'll discuss their routine and your routine. They'll then do a dynamic and a static assessment. So that means they'll move the horse, they'll walk, trot, potentially circle, and then they'll work up statically, assessing where the horse is sore. They might avoid trying to step back in pairs.
Yes.
Also, we want them to step back in a straight line. If they're struggling to flex their hind limbs, they'll often step back with a wider gait.
Okay.
Good lad. See what he's like.
Stand up, good boy.
So if you just ask him to back up for me.
Back. Back.
That's it. And then just walking forward a little bit more, see if you can get him straight. That was really good though.
Good boy.
Fab. And then ask him to go back for me there.
Back. Back. Good boy. Back. Back. Good boy, back.
Good boy. That's great. That's fab. Then we work over the muscles. Just putting a little bit of pressure, assessing how tight they are or if they're sore.
Yes.
So they're a little bit tight through there. And they become more tight when we get to sort of the back end of what we call the thoracic vertebrae.
Okay.
So I'm just going to work over the muscles now to test again like we did on the other side. Good boy. Good boy. Good boy. Good boy. So yeah, just reactive in the same places pretty much as he is the other side. Again, it's what we call hypertonic. It's very tight.
Yes.
He's probably got reduced blood supply to that area. So there's lots of things we can do in the treatment to target that. We can work on using electrotherapy to improve the state of the tissue, and then we can use manual therapies as well. And from a home care advice, that's probably when we'll start to incorporate the licks and introduce some baited stretches.
Perfect.
Moving nicely on 2 tracks there. When he's straight, when he's concentrated. Good boy. That's fab. And then if you just turn him for me and walk him back.
Good boy.
And then on your way back this time you can trot him.
Okay. Good boy.
Good boy.
Good boy.
Good boy. Good boy. All right, good boy. Good boy. Good boy, Zach. Then they'll follow on with treatment. So they'll decide what the best approach to treatment is. They may use electrotherapies, manual therapies, or remedial exercises such as the baited stretches. Following on from all that, they will then advise home care wise what you can do to achieve the aims, and they will often advise on any remedial exercises or homework that you need to do. How to prepare yourself and your horse for physio is quite simple. You just want to make sure the horse is as clean as you can possibly have them. You know, it's hard in winter with a lot of mud, but as long as they're clean and all the limbs can be seen, that's great. Ideally, you would like them indoors in a well-lit stable, but you'd also like access to somewhere that allows a thorough trot up to be performed. So a driveway, an arena, a lane, anything like that's going to be ideal.